Ectopic testis. What is the definition of ectopic testis? To know the definition of ectopic testis, we need introduction. We all know the development of the testis. Originally, the testis is formed on the posterior abdominal wall in the lumbar region, and its lower ball is connected to a fibromuscular contractile structure called gubernaculum. The contraction of gubernaculum depends on maternal chorionic gonadotrophins, which pass to the fetus, leading to contraction of the gubernaculum. The gubernaculum connects the lower ball of the testis to the bottom of the scrotum. And this part which connects the gubernaculum to the bottom of the scrotum is called the main scrotal tail of the gubernaculum. Main scrotal tail, this means that there are accessory tails. Yes, there are small accessory tails of gubernaculum. One accessory tail passes to the inguinal region, and one accessory tail passes to the femoral triangle, and the accessory tail passes to the perineum, and the accessory tail passes to the rotopenis or suprapubic region. Therefore, there is main scrotal tail of gubernaculum, which normally pulls the testis to the bottom of the scrotum. And there are 4 accessory tails. Accessory inguinal tails pass in the subcutaneous tissue of the inguinal region. One accessory tail to the rotopenis and suprapubic region called suprapubic tail, which pass in the subcutaneous tissue of the rotopenis and the suprapubic region, and femoral accessory tail in the subcutaneous tissue of the femoral triangle, and one accessory tail pass in the subcutaneous tissue in the perineal region. Usually, the main scrotal tail pull the testis and its vessels, lymphatics, and autonomic supply of the testis down to the bottom of the scrotum. During descent of the testis, a fold of peritoneum descends downward to the bottom of the scrotum. This is the peritoneal cavity because the testis develop retroperitoneal, and this is the peritoneal cavity. And the testis descend retroperitoneal to the bottom of the scrotum. During descent, this fold of peritoneum descends to the bottom of the scrotum called processus vaginalis. Normally, the testis reach the internal inguinal ring about the 6 months of intrauterine fetal life. Reach the external ring on the right side at the 8th month. Reach the bottom of the scrotum just before birth in the 9th month intrauterine. This is the normal. The testis pass in the abdomen to the internal ring, to the inguinal canal, to the external ring, to the bottom of scrotum, reach the bottom of scrotum on the right side, just before birth. But you should notice that the left testis descend 1 month earlier than the right testis. Therefore, anatomically, when you look to the scrotum, you will find that the left testis is lower in level than the right testis. Therefore, the left testis descend earlier by 1 month. Normally, the processus vaginalis. The processus vaginalis normally just before birth, its proximal part becomes obliterated and called vestige of the processus vaginalis. Vestige of processus vaginalis. The proximal part only obliterate, while the distal part persists as a serous sac. And in this serous sac, the testis invaginate this serous sac. And this serous sac surrounding the testis is called in adults tunica vaginalis. And you all know that the tunica vaginalis, as any serous sac, there is a layer in contact with the testis called the visceral layer, and another layer covers the testis and the visceral layer and lines the scrotum. This layer is called the parietal layer of the processus vaginalis. This is a normal development of the testis. Our subject in this video is ectopic testis. What is meant by ectopic testis? Ectopic testis is congenital anomaly in which the main scrotal tail rupture or degenerated or absent. No main scrotal tail. Therefore, the testis does not descend to the bottom of the scrotum. But one of the accessory tails persists and pulls the testis. In this case, the testis descend normal in the abdomen, in the internal ring, in the inguinal canal and external ring. Normal. But here starts our congenital anomaly. There is failure of descent of the testis to the bottom of the scrotum because there is absence or degeneration or rupture of the main scrotal tail. And now the testis migrate in the subcutaneous tissue in abnormal site. It may be usually pulled by the accessory inguinal tail, and usually the testis lies in the subcutaneous tissue in the inguinal region. But it may be pulled in the subcutaneous tissue to the femoral triangle, or to the root of penis, or to the perineum. Therefore, definition of ectopic testis is the testis descend normally until it passes through the external ring. Then it passes in the subcutaneous tissue to an abnormal position. What is the etiology? Rupture of the main scrotal tail and the persistence of one of the accessory tails, which pulls the testis subcutaneously in an abnormal site. What is the commonest site for ectopic testis? Usually in the subcutaneous tissue of the inguinal region. Less commonly in the root of penis, perineal or femoral. What is the effect of ectopic testis? No effect. What is the function of the testis? Two functions: hormone production, and hormone production doesn't need a specific temperature. The testis will produce hormone in any temperature. And the main function of the testis in males is production of sperms, spermatogenesis. And spermatogenesis need temperature lower than that of the body. It needs temperature 33.5 centigrade. The two functions not affected in ectopic testis. Why? Spermatogenesis. The testis is subcutaneous, outside the abdominal cavity, with the temperature lower than the abdominal cavity, and spermatogenesis will not affect it. And hormone production not affected. Therefore, no effect of ectopic testis. What is the clinical picture of this condition? This is the clinical picture of this condition. Where is look for the right, compare left and right side of the scrotum. Here on the right side, the scrotum is large, well developed, containing right testis, while the left side of scrotum is empty, and the scrotum is not well developed. And what is this? The testis can be seen and they can be felt in abnormal site in the subcutaneous region. Here in the subcutaneous region of the inguinal region. This is inguinal ectopic testis. It may be here in the root of penis, or here in the femoral triangle, or maybe here in the perineum. What is the differential diagnosis of ectopic testis? The differential diagnosis of ectopic testis is the next video. What's the next video? Undescended testis. Treatment. Treatment is very simple. Dissect the testis and the spermatic cord to the bottom of the scrotum, and this is easy operation because the spermatic cord, vas, vessels of the testis are longer than the normal. Therefore, it is easy to dissect the testis, vas, spermatic cord, descend of the testis to the bottom of the scrotum, and fix the testis in the bottom of the scrotum. Fix means bexy. Fixation of testis is called orchidobexy or orchiobexy. Orchio or orchido is testis. Therefore, the operation of fixation of the testis in the bottom of the scrotum is called orchido, which means testis, and bexy, which mean fixation. Therefore, this simple operation is orchidobexy, and this simple easy operation is easy because the spermatic cord containing testis and vas are longer than normal. It is very easy to dissect the spermatic cord and the testis, descend to the scrotum, fixation in the bottom of the scrotum by operation called orchido or orchiobexy. This is the ectopic testis. Thank you for good listening and good luck.